Thank you so much, Lola. I hope I can live up to all that you've said now. So, welcome everyone. Good morning to my fellow colleagues. I recognize many faces here, and it's a privilege really to be here today and present something that we've worked on at the Hospital for Sick Children. As Lola mentioned, I'm Anita, staff interpreter at SickKids, and with another colleague, I can't present this without making honorable mention to another colleague who had the idea to develop this quality initiative at SickKids, and with another member from an external interpreter service agency, Grace Egan, who many of you may know, who worked with us in terms of sustaining the program. So I'll be speaking about the Quality Initiative project on debriefing for interpreters that we developed at Interpreter Services. To give you a brief outline, I'll be providing some background on the institution where I work, and I'll also explain the case for debriefing, why it came about and how. I'll give a brief definition of debriefing, and then I'll provide you the process of the Quality Initiative project, and also some preliminary evaluation results of the project with outcomes that we had hopefully planned for, and we did see some of the outcomes that we had planned for, as well as let you know of our plan for sustaining the debriefing program in the future. And hopefully we'll have time for discussion and questions, because I find that that's when all the rich conversation really comes in. So to give you some background on Hospital for Sick Children, and many of you, because I see familiar faces, already have been to interpret for us. The Hospital for Sick Children is actually a tertiary and quaternary care hospital that provides a full spectrum of healthcare services across the continuum of care to young children, newborns, and youth up to the age of 18 years. So there are over 8,000 employees at the Hospital for Sick Children, both healthcare professionals, new fellows, trainees from around the world, support staff, admin staff, all working together for the same mission. The key to SickKids' mission is championing an accessible and comprehensive and sustainable child health care center that is family-centered care. So the work that we undertake in the area of cultural competence, and that includes providing language services, is aligned with our mission. So how did the case for debriefing come about? Well, we were recognizing that there was an increased nature of emotionally challenging encounters that staff and contracted interpreters were experiencing when coming to the hospital and working for patients that were in families that were very distressed. So we thought, we recognized that interpreters were working in our specific healthcare setting, were often exposed to these distressing and difficult situations, but yet they had no outlet. We didn't have any structure or formal mechanism whereby interpreters could come by and speak to us, after a stressful situation. So IS stands for Interpreter Services. Our department lacked the formal support structure for the staff and contracted interpreters, and we recognized the need to provide some form of, whether it was formal or informal, we weren't sure at the time. We were just thinking, how can we make this work? What can we do to provide more support for interpreters? So we thought, let's look at debriefing. Now, we had to understand what debriefing was before being able to do that. And we know it's defined as a process where support is given to groups or individuals that have experienced an incident. But when we're looking through literature, such as specifically the critical incident stress debriefing for disaster management and response in the US, we recognize that the main focus of debriefing was to relieve stress at an early stage. So we needed to be able to provide some form of debriefing within 24 to 48 hours if it was going to be impactful. And also the disaster management response literature also defined it as an incident affecting an individual or group and the subsequent need to express their view of the incident in an informal or formal way. Thus, the quality initiative began. One of the staff interpreters, Dale Linda Waugh, who many of you may know from not only SickKids but also in the community of interpreters, she was the first to recognize the gap of not having any form of debriefing. So she took it upon herself to speak to our managers and our team, and with our managers' support, and as well with the knowledge and experience of another social worker at SickKids who had developed a debriefing program and actually a policy for debriefing in the hematology oncology service at the hospital, we were able to develop the quality initiative. And our aim was first to develop a debriefing training module. We had to train our staff, first of all, to be able to provide and facilitate debriefing. We didn't have knowledge on how to do that. Secondly, we had to be, once we were trained, we wanted to provide increased support to interpreters through a formalized mechanism. That is, have interpreters come in and sit down and have a structure for the debriefing. And thirdly, to facilitate the formalized debriefing on a regular, consistent basis. And that was with the plan or the hope to ensure that we had open communication with the interpreters, that we would look at providing hopefully stress reduction and global well-being of the interpreters. So what did the quality initiative process look like? First we had, as I mentioned, a staff debriefing training, and this was done on a half-day retreat with the department, and it was facilitated by the social worker at SickKids at the time. Her name is Debbie Berlin-Romales. She is no longer with SickKids, but she's still providing social work. And she's in the community, and she's also instructing at the Faculty of Social Work at the University of Toronto. And you can also find her on TED Talk if you're talking about debriefing, if you'd like to look into it further. But so she was the champion really in developing the policy for debriefing in the hematology oncology program or service at the hospital, because she recognized that the nurses and staff on the hematology oncology floor didn't have a forum to express their stress after patients were dying. And they were recognizing a lot of sick time taken, a lot of sick leave. So once she spoke to her directors and was able to develop a formal debriefing and implement it in the policy, so that whenever there was a patient who had deceased, they would have an immediate debriefing with the staff within 24 to 48 hours to make sure that they captured, that time. So she facilitated our training and helped us look at practice debriefing. And at the training, we also filled out an evaluation prior to the training, so that we needed to measure what we did understand of debriefing, whether there was a need, whether it was a perceived need or not, and also an evaluation after the training to look at whether, what did we learn? Did we really find that debriefing was necessary? Once we were able to train after that full day, then Dale, Linda, and I looked at implementing the debriefing practices with the rest of our department and with the contracted interpreters. We wanted to provide one-on-one immediate debriefing so that, when interpreters were coming in, and if sometimes we weren't able to give context in terms of, what the appointment or what the encounter would be like. And interpreters would come in and find out, they were going into a palliative care case, and afterwards come back and not have a place or someone to speak to, and that's when they really needed it. So we wanted to be able to provide that in the office, one-on-one, if and when necessary. We wanted to be able to provide a group debriefing, so we were thinking about scheduling debriefing sessions bi-weekly or monthly. We were planning that, and also developing an evaluation form for the contracted interpreters that would come into the debriefing so that we could assess whether we needed to look at changing what we were doing, because we were new at this as well, and how to plan to sustain the program if in fact it was successful. Also, the evaluations would help us look at outcomes, whether the outcomes of the debriefing were successful or whether we were achieving what we needed to achieve, and what changes we needed to make, and as well look at a plan for sustainability. Because this was some work that we were doing above and beyond our daily interpreting, we needed to find a way to sustain it longer term. We thought, we need to train more people, and then eventually as interpreters become trained in debriefing, they can debrief each other daily, wherever, whenever. So I have there who, what, where, when, why. And so basically our idea was to provide the debriefing for staff, but mainly contracted interpreters, because the staff, we were there every day and we had each other. What to provide debriefing, when we were looking at providing it within 24 to 48 hours for the one-on-one, where we wanted to be able to have the same place, to be able to provide the sessions in the same place, and why, to be able to give interpreters opportunities to get rid of all the emotional burden that they may have been carrying. So I mentioned to you already about the staff debriefing training and what it looked like and who our facilitator was, and then the implementation of the debriefing practices. Once we pulled it together, we did a little flyer working together that we worked with an external interpreter service provider and Access Alliance, and we had them market it for us. We sent it out to all interpreters to be able to, and we sent it out to MCIS and initially, and I'm not sure, we had a number of interpreters come in the first sessions, and we noticed that the second session was less well attended. So we realized we had to change up the dates and the times, because we wanted it to be not another burden for interpreters to get to this debriefing session. We wanted it to be at a time when they weren't losing income, at different times, lunch hour, after work, 4:35. We offered it different times, bi-weekly and monthly, and then we decided also to change up the forum, the actual location, because we thought maybe it was, having it always at SickKids might have been somewhat prohibitive. So we decided, let's go closer to the Danforth Clinic area. Let's go have another session closer to, Toronto Western Hospital. And so that's what we did. So what did the actual group debriefing procedure look like? Well, first we sat around, it wasn't even a round table. We just put the chairs in a circular formation to make it informal and open. And initially, we had everyone introduce themselves, and we thought it was extremely important for everyone to understand that you know, we were abiding by confidentiality, right? So that anything that was said within the room was to be kept within those four walls, so that interpreters would feel comfortable opening up about something, and they wouldn't feel judged, or they wouldn't feel that, you know, maybe they were going to be chastised for a technique that they used within that session, or judged for being weak at a certain moment. No, it wasn't for that. We wanted them to know that, you know, we weren't there to judge. And also we started with a brief meditation and a breathing exercise. And we also let interpreters know, you know, if you wanted to participate in that 2-minute breathing exercise or meditation, then you could, but it wasn't obligatory, because that meditation or that form of breathing exercise isn't to everyone's taste, right? Maybe some people would get anxious for staying there, sitting down for 2 minutes and meditating. So we thought if you wanted to participate, then you could. If not, then, you know, that was fine too. And we had the introductions, and there was one other point that I wanted to say that was, it'll come to me, about the welcome, that, I can't remember, it'll come to me. It was an important point. So, once we did the introductions, we asked the participants if someone had something to share. If they had something to share, then we would allow them, you know, to open up and listen in on what they had to say. If no one wanted to open up, then we would give an example, just so that it would make it easier. And then we would inquire about the encounter. We would ask them questions. And open-ended questions, so not just like, you know, was that difficult for you? Not just yes and no. We wanted to hear more and say, well, how did that make you feel? And, you know, what coping strategies did you use? Because we would inquire about the effects of the distressing encounter, strategies that they used for coping, and then we offered supports and resources available afterwards. And we developed this, one of the resources we developed was a bookmark on the one side. It was also strategies and skills on when you're going to an interpreting assignment that was challenging, or if you know it was distressing and challenging, and if you didn't know, what you could do afterwards. Then at the end we did a wrap-up and conclusion, thanking everyone for attending, and we had them fill out an evaluation form, because again, we needed to know how we were doing. So the preliminary results, I can give you some of those, because over the course of 1.5 years, we probably conducted 24 sessions, debriefing sessions. And so our preliminary results were these. We had 11 questions in the evaluation, and with a comment section at the end. One of the questions asked, overall, I feel the debriefing session was well facilitated. So we had a 93% success rate there. So on a level of 1 to 5, with 1 being completely disagree and 5 being completely agree, the majority, as you can see, 39 out of 42 the participants there agreed that the session went well. Question 2 was, the debriefing session provided a safe environment for me to share my feelings. Again, we had a 93% agree rate. Question 6 was, I have a greater appreciation of the importance of understanding my emotional responses when interpreting. And that was an 86% rate. Question 8, I learned how to be more mindful of my triggers when interpreting. That was, again, 81%. So we started to see that, you know, maybe we needed to work on helping people identify what they were feeling. Oh, that was the point that I wanted to say, that when we were having, I just remembered, in the procedure of the debriefing, we also let the participants know that this was not a therapy session, because we were not therapists, we were just facilitators of the debriefing. So, you know, we weren't there to evaluate whether further therapy would be needed in some of the situations. We would refer them, if they felt that they needed further counseling, then to speak to our manager. Our manager is a social worker as well, and she would have the skills to be able to, refer the person to the proper channels. Question 11 was, I feel supported as an interpreter by SickKids Interpreter Services staff, and that was an 88% rate of agreement. So overall, I feel the debriefing session was well facilitated, what's highlighted there. That was successful as well. But we also had an opportunity, as you see in question 6, to look at where we might need to change a few things, or where there was an opportunity for us to improve. Because if you look at question 6, I have a greater appreciation of the importance of understanding my emotional responses when interpreting. We had about 6. So we felt, we're starting to, and here we see some more, especially in questions 9 and 10. I learned new strategies to cope with challenging interpreting encounters, or I learned about new resources to cope with challenging interpreting encounters. So we could see some higher numbers towards the disagree. So we found, the sessions were probably, we weren't giving enough responses in terms of support. And I think because I was in the majority of the sessions facilitating, I found that we didn't have enough time. The sessions were 1 hour long, and if we had, even a group of 4 or 5, there just wasn't enough time for everyone to share what they wanted to share, and we didn't want to rush interpreters. And then at the end, we found we were rushing to give them information on self-care strategies or further supports. And so that's where we realized afterwards that we needed to work on that. So there was an additional comment section at the bottom of the evaluation, and these were some comments from the participants. To construct an online platform for interpreters to interact and share thoughts with each other. Another, I wish we could have a longer session, continue the good job. Another was the room was too dark, because we would often turn down the lights so that it wasn't, so that it could be more of a calm environment. But again, that's, that was our perspective. Perhaps for some people it wasn't a calm, right? So we had to be more mindful of that. Also, another comment, more sessions will be more helpful. Again, thank you. Interesting and relevant issues include ethical and moral conflicts and tensions as variously described. And another comment, end sessions with something positive and uplifting, because they were heavy comments, and people were speaking about bereavement and trauma, and at the end we ended flat. So we needed to look at ways to change that too. So the informal evaluation results. For the most part, we could summarize that there was increased self-awareness. So this is all, combining the evaluation results, that the interpreters did have opportunities to practice self-care, that they did have some new knowledge of debriefing, and some new available supports and resources that we let them know about, and other resources that we created, like the bookmark. Long-term outcomes that we hoped to achieve, and still continue to hope to achieve with the sustainability of the program is learning and accountability, some closure for interpreters when they're suffering, when they're going through difficult situations of difficult encounters. More healthcare team cohesion, perhaps looking at, when interpreters are going to difficult encounters, to have the staff debrief them before, or brief them before, and then debrief afterwards. to look at prevention of compassion fatigue and more of a promotion of culture of safety. Because if we kept the interpreters healthy, we knew that they would be able to do a better job when going to their assignment. So how did we sustain the program? Well, we needed to find a way to have the program continue without us being the facilitator. So we spoke to our external interpreter service provider, and that being Grace Egan, a business manager of language services at Access Alliance. And we looked at collaborating with them to transition the debriefing program to Access Alliance so that they could provide it for the interpreters even as a model of professional development. And they helped us as well with the development of the resources for the bookmark and with funding the resource as well. Looked at ongoing evaluation, continuing to evaluate the debriefing program to ensure that we could implement any changes that came from the evaluations and per the feedback, and to continue to provide self-care tip resources to the interpreters. So recently I've spoken to Grace to see how they're doing with the program, and she mentioned that the transition of the debriefing program, so far they've had 6 interpreters trained as co-facilitators for debriefing, and also a social worker and some nursing students who are doing a placement there at the CHC. They have experience in facilitating peer support groups, so they're offering further facilitation to the interpreters with the other interpreters who were trained. And also they thought about a workshop called Remaining Professional in Challenging Situations. So an experienced interpreter trainer, and I believe it's a Melanie Oda, was hired to deliver this free workshop to interpreters to explore ethical challenges faced by interpreters, and also reviewing ethical principles behind the standards of practice. Now, Grace mentioned also there's a waiting list for the workshop to be delivered again, so it was very successful. And also there appears to be a need for an annual refresher of the ethical principles and standards of practice. So again, the Access Alliance will be offering weekly and bi-weekly fall-winter debriefs, and now upcoming next week, scheduled from November 27th to December 15th. And interpreters will be compensated for their time as co-facilitators, as well as getting PD points. And there will be student co-facilitation, which counts towards placement. They have a drop-in format that suits interpreters so that they don't feel that it will affect their schedules. And again, they will hand out the resource sheet, bookmarks at each session, evaluations at each session. And during the sessions, they will identify certain themes that they find are common, so that they can look at targeting specific areas for other workshops in the future, for structured workshops. So we have something structured and semi-structured that's planned for future. And of course, all of even though they'll be identifying themes that come out of the debriefing sessions, always keeping in mind confidentiality so that they don't break that. And so I just found this interesting that people don't learn from experience, they learn from reflecting on experience. And that's what basically debriefing is about, having an opportunity to reflect on an incident. And that's it. So I'd be happy to answer any questions. And I also want to thank Grace from Access Alliance and Delinda, my colleague at SickKids.
Yeah, just a quick one. Just now you mentioned CHC. What does that stand for?
That's Community Health Center.
Thank you.
I was going to say clinical. My head is always in hospital. Community health center. Yes.
Thank you. I have a practical question for you. How do you choose interpreters and how does it practically work when you have do you prepare the interpreter before he or she comes?
Before an encounter, you mean?
Yes, or is it spontaneous?
No, okay, so in terms of subject matter or context,
Yes.
so we don't always have information on the context of an assignment. We try and ask, once we receive a request from the floor or from a clinic, we ask to have some information on the diagnosis or what the subject matter will be, but that isn't always possible. Sometimes they give us a diagnosis, and so, you look up the diagnosis and get some information in terms of being ready for the medical terminology, but then you may go into that assignment and find that it's changed completely, whether if it's an inpatient that their status or condition has changed and deteriorated, so the diagnosis is no longer the focus of the conversation. It's the condition, deteriorating condition of the patient. So we don't always have that. We try, and that's one thing we do ask from the healthcare professionals to provide, and that's information that we give to the interpreter service provider when we're requesting. But again, it's not detailed. It's not up to date, perhaps.
So when they come, they're not necessarily prepared about it.
Exactly. Yes.
Debriefing is very good for the healthcare, for the health and the well-being of the interpreter. I wonder if so far we have any follow-up study on the lifespan of interpreters who are exposed constantly to traumatic experience interpreting encounters.
Traumatic effects of interpretation.
Yes.
There is literature on the effects and consequences, psychological and physical consequences of trauma that interpreters are exposed to. If you look it up, you'll find a lot of literature on that. But in terms of what we've done within our work, we haven't done any sort of literature other than informal recognition of the physical effects.
Okay, may I know what time in which year the SickKids started debriefing practice?
So this was started a couple years ago, and we had to, before we implemented the actual debriefing, we had to be trained as facilitators, right? So there was a process, and there was a quality initiative that we had to go through our quality risk and management to ensure that they approved the quality initiative first, and then after the training we were able to start facilitating. So over the last year and a half we were providing or facilitating debriefings, and the last 6 months we handed it over to Access Alliance to continue the debriefing.
Thank you so much.
Thank you. Any other questions?
You mentioned that there was a debriefing program set up for the oncology department. I wonder if there has been some thought about integrating the interpreter as a member of the team in multi-profession debriefing sessions, which would have other benefits as well.
Exactly. That's a very good point, and that's something that is easier for staff interpreters that are there in the hospital to be called upon, when they do the debriefing with the staff, because the staff are there easily. I've been asked to go to a debriefing for a palliative care program, and that was easy for me to go to. But with the contracted interpreters, that's where it's a bit more challenging to have them come in again, right? with the hematology-oncology program, they're certainly open to include interpreters. They have in the past, and I'm sure if we approach them to do it on a more consistent basis, they would be open to that. With other programs, because it's not in their policy, they actually don't have any structure or protocol to do that. Although I can say that also having, being part of the Caring Safely Committee, which includes parents and children on a committee, we are looking at including interpreters in rounds, right? Especially in the general pediatric units, so that interpreters are called not just when they're about to interpret, but just before they start interpreting. When rounds start, interpreters will be privy to the information. They have context information, they have support of all the other professionals around, and they're included, you know, in that health, that's that healthcare team cohesion, right? Yeah. Very good point. More work to be done, for sure.
Thank you, Anita. Those were great. I actually applaud you and SickKids for taking this initiative. It's extremely important, absolutely. My question would be, I know this is provided for you guys and a lot for the interpreters that work at SickKids or somehow are contracted by SickKids, either internal or external, especially the partnership of Access Alliance, which is fantastic. But there is a great need for this kind of sessions, not just debriefing, but any kind of sessions that actually expose people to the dynamics within the hospital and the difficulties and challenges, especially emotional. They are many. I wonder if this is something that you would be able within your services also to promote externally. So, for instance, even through Apply now, a more organized forum, if you want to put it that way, if these can be offered in the future for other interpreters that not necessarily are going to SickKids right now. Because I do see the great need and great advantage of having a program like this somehow, you know, in part of an accreditation, a certification, or even an organization that has interpreters.
That's a great idea, and I certainly would be open to a collaboration. I think that, you know, we just would have to bring it back to our directors and ask for approval, and then I would certainly be open to that. I completely agree that there is a great need and that we haven't been able to capture the entire, you know, interpreter population, unfortunately, but perhaps that's something we should look into, and thank you for offering that as an opportunity for us. I'll bring it back for sure. Thank you.